Current research strongly supports that biological factors impact behavior and mental health. However, we must always consider that these factors are also influenced by environmental issues. Therefore, the debate of nature versus nurture continues. The more we learn about genetics, the stronger the argument is that behavior and emotional disabilities are greatly impacted by biological factors. There are many conditions that are linked directly to genetics. For example, schizophrenia, ADHD, anxiety disorders, even some antisocial behaviors. However, the research also shows that those same behaviors and conditions are also influenced by the environment. So therefore, even though people may have a genetic predisposition for certain conditions, the environment can impact whether that person actually develops those conditions or how severe those conditions may be. Most of the time, individuals inherit a predisposition for certain behaviors or emotional disorders rather than actually inheriting the disorder. Having a predisposition for a mental illness or behavior disorder simply means that a person has a genetic makeup that puts them at a higher risk of developing the disorder. For example, schizophrenia is a mental illness that has a strong genetic link. But there are also environmental factors that may influence whether a person actually develops this condition. For example, drug use and high stress may contribute to a person who has a predisposition for schizophrenia to that person actually developing schizophrenia, while a healthy lifestyle and avoiding stress may actually help that person to prevent the development of that condition. Traumatic brain injury. Students who have experienced a traumatic brain injury may exhibit behavioral and emotional issues. However, this is a separate special education category in the state of Virginia. Although malnutrition and some food allergies and other allergies may impact behavior, it is highly unlikely that they would be the cause of a serious emotional disorder. It is not surprising that temperament plays a large role in the development of emotional or behavioral disorders. However, once again, environmental conditions make a difference. Two children with very similar temperaments may show very different outcomes due to differences in environmental factors. A nurturing environment with clear limits that teaches and reinforces coping skills and management of emotions can have a tremendous influence on how a child with a challenging temperament learns to cope. Although our influence on biological factors is very limited, as educators, we should understand some of these causes so that we can work with other agencies who may be addressing the medical needs of our students. As educators, we should be very careful not to recommend or suggest medical interventions to our students or to their families. The law in Virginia is very clear about educators making educational decisions and medical practitioners making medical decisions. At best, our role should be to share important information with those who may be treating our students medically or to refer parents to doctors regarding their medical questions.